Hi, it's Patrik Hutzel from ICU.The ICU with another quick tip for families in intensive care. So currently we're working with a client who has their 34-year-old brother and son in ICU with liver failure. Apparently there's a history of drug abuse and alcohol abuse, but that's besides the point. He's still only 34 years of age, and he's a very young guy that deserves the best treatment at such a young age. But even if he was in their 80s, still deserves the best shot at treatment. It's irrespective of age. So the family is basically saying that the ICU team wants to withdraw treatment and says that they don't want to put their son and brother through all this suffering to get him to the other end. And they feel it's cruel continuing treatment. Now, as you may know, I have worked in intensive care for over 20 years, and I've seen those situations over and over again. Now, let me be clear, when someone is critically ill in ICU, there is going to be some pain and some suffering. That's not the question. But he's 34, and can he go through some pain and suffering to live? That's the question. And his family thinks that he can go through pain and suffering to live. So the ICU team is pushing or pressuring the family to sign a DNR, or do not resuscitate order. And again, they can't do that without actually having the family giving consent. So that's really good. ICUs, as you may have heard me say before, are very good at pretending they're operating in a vacuum, and that is simply not accurate. They're often pretending they're operating in a vacuum when it comes to end-of-life decisions. And again, end-of-life decisions cannot be made without family consent. Any end-of-life decision that is purely made by an intensive care team that leads to a patient dying is actually murder. There is no other term for that. It's the deliberate killing of a person that could have a shot at life with intensive care treatment. So going back to our client, the question now is, can their brother and son have a tracheostomy, because he's been on a ventilator now for over 2 weeks. And the question now inevitably comes up whether a tracheostomy should be done or not. Now, if somebody can't come off the ventilator because they're not waking up after the induced coma, they should have a tracheostomy. That is best practice and evidence-based practice in ICU, and it buys people time to recover. And it buys people time to recover in their own time. Now, ICUs are always trying to manage their worst-case scenario. What is their worst-case scenario? Their worst-case scenario is to look after a critically ill patient in ICU indefinitely with an uncertain outcome. And this is exactly what's happening in this situation. It's an uncertain outcome, and the ICU doesn't want to put the resources towards this young man to save his life. Then the next question is, if the liver doesn't recover, could he potentially qualify for a lung transplant? Now, I can't answer that question from here, but it's certainly a question that our client needs to ask the intensive care team, and maybe our client needs to be transferred to another hospital where he has a higher chance of getting a liver transplant. So my tip for today really is never give up and never take the ICU team's word for gospel. You need to do your own research, because you don't know what you don't know. You don't know what to look for, you don't know what questions to ask, and you don't know how to manage doctors and nurses in intensive care to get the best outcomes for your critically ill loved one. That's my tip for today. Go and like this video, comment below what you want to see next, and subscribe to my YouTube channel for new updates for families in intensive care. And also go to our website, intensivecarehotline.com. If you need help, call us on one of the numbers on the top of the website. This is Patrik Hutzel from intensivecarehotline.com, and I'll talk to you in a few days. Take care.